On governance, we have seen stronger oversight and accountability, with over 60% of our National Council on Health resolutions being implemented, and 90% of states have conducted their own reviews. Yet, we must acknowledge that our overall performance on the Sustainable Development Goal 3, which has to do with health and well-being, remains a bit off track. Service coverage is low and financial protection is inadequate, underscoring the urgent need for deeper investments and policy reform. Distinguished ladies and gentlemen, the 2025 review will feature the unveiling of Citizens' Voices survey. This was done to give Nigerians the opportunity to speak directly to the strengths and gaps of the health system. And we will focus on 3 strategic reform challenges. 1, strengthening the human resources for health, improving coordination across actors and programs, and enhancing resource efficiency and accountability by reducing waste and duplication. Distinguished ladies and gentlemen, the Federal Ministry of Health and Social Welfare continues to lead national efforts towards achieving universal health coverage and health-related sustainable development goals. And one truth remains clear: reliable statistics are the compass by which we navigate. They are essential for tracking our progress, identifying gaps, and holding ourselves accountable in the delivery of quality healthcare services. This will therefore reduce duplication of efforts, optimize resource allocation, and streamline processes and enhance donor confidence. Let this meeting, ladies and gentlemen, serve as a reaffirmation of our commitment to continuous improvement. We must embrace the spirit of learning, celebrating our successes while critically analyzing our shortcomings. As we review our progress and set our priorities for the upcoming year, let us keep our focus on measurable outcomes. We owe it to the Nigerians we serve to ensure that our efforts translate into tangible improvements in their lives. It is my sincere hope that the Nigeria Health Statistics 2025 will deepen our understanding of the health landscape and inspire renewed commitment to improving the well-being of every Nigerian through data-informed policies and programs. Let me take this moment to recognize the invaluable contributions of our partners, the National Bureau of Statistics, the National Population Commission, all our development partners, donor agencies, states' ministries of health and their parastatals, health agencies, service providers, academia, National Assembly, the private sector, and the members of the media. Your collaboration has been instrumental in bringing this report to life. In conclusion, as we commence this review, I encourage each and every one of us to engage in dialogue throughout the sessions. Share your insights, successes, and challenges. Collaboration will be the key to our continued progress. Let us continue to strive for a health sector that is resilient, equitable, and responsive to the needs of all individuals in our society. Thank you all for your kind attention and for your dedication to this noble cause. As we look forward to the upcoming National Council on Health holding in Calabar from the 17th to the 21st of November. Thank you all for listening. My name is Daju Kachalum, MNI Permanent Secretary, Federal Ministry of Health. You're welcome.
Thank you very much, Permanent Secretary, calling for open dialogue where we'll share success and, of course, learn from the challenges. Would at this point like to welcome most heartily the coordinating Minister of Finance and the Economy, Mr. Olawale Edu. You're welcome, sir. We are going straight to the business of the day. At this point, I'd like to start from home. We We start from the traditional and religious institution. That's what we have a lot of respect for in this country. And because diseases don't have borders, we'd like to call on our royal fathers who are ably represented here. I'd like to invite the Emir of Shonga, himself a medical doctor, a public health activist, I dare say. Please welcome with me His Royal Highness Alhaji Dr. Yahaya Haliru.
Honorable coordinating ministers, all other protocols observed. Mine is very brief. The Sultan is supposed to be here, but he's unable to come. He's asked me to stand in for him. I was going to make some comments later, but I'll combine that and say something very simple and straightforward. I bring you greetings from the traditional institution and from the programs we've all been involved in. It gives me real great pleasure to be here to participate in this event we're having here. The joint annual review is crucial as it allows us to reflect on progress, identify gaps, and strengthen our shared commitment to a healthier nation. Health is the foundation of community prosperity. When our people are healthy, our children can learn, our farmers work, just as simple as that, and our economy can thrive. Healthy citizens produce families, strong economies, and more peaceful society. The combination of health, education, and job opportunities lead to democratic dividends, which is a way of increasing our prosperity. And I think we're also taking it now into GR. The traditional institution or rulers remain close to the people and play a vital role in promoting health awareness and mobilization. We have had, you've seen the impact we've had in community involvement as far as immunization and other health programs concerned. So need we say more? Now, I commend the Honourable Minister, the indefatigable Minister, I call him, with the indefatigable team and PAMSEC for their hard work. If I can just digress and say a small note, I've known this gentleman for several years. I ask him every time whether he sleeps at all. Well, I will leave that as personal, but he's very hardworking, and I can understand the confidence that the head of state has in him, in getting to. But the more successful you are, the more hard work you are given. Now, the leadership, I commend the Honourable Minister and ministers and the leadership of National Primary Health Care and other heads of agencies and partners for their dedication to improving our health system. It's many hands, as we say. So the progress is revitalizing primary health care and expanding access to other services is quite here for us to see. The red letter that came out recently to us, we know what that means. It's making us to really pay attention to the funds and where the funds are going and making sure they're going to work. Let me just say one more extra point, which might be I want to just mention that this re-engineering process is going very well, but the more you look, the more you see, and the more you get involved. So brace up. It's not a small job at all. But I want to just mention one area which is coming out again, also coming in. That is staff, professionals. They were now beginning to over-specialize, and that will cause more problem in the future. We already have problems of whether X-ray is relevant or not, but if you are looking after one patient, and I'm going to have over-specialization in what I don't need for that patient, then let me go to the academics, rather than coming to the health system to try and clear it out. So over-specialization is the next threat I'm seeing burgeoning. Finally, as custodians of people's tradition and culture, including the health-seeking behaviors, we reaffirm our readiness to support government and partners in ensuring quality healthcare reaches every Nigerian. Together, we can ensure that every Nigerian, no matter where he lives, enjoys access to quality and affordable healthcare. May this second edition of Joint Annual Review your fruitful deliberations inspire even stronger action for health and well-being of our people. Thank you. May God continue to guide us in this mission.
Thank you very much. Shall we please again appreciate that message from the traditional institution? I'd like now to call on the Christian Association General Secretary, Professor Samson Fatokun, to please deliver his goodwill message.
Thank you. Good day, everyone, and greetings from the General Secretariat of Christian Association of Nigeria. My name is Apostle Professor Samson Adetunji Fatokun, representing the President of CAN, His Eminence Archbishop Daniel C. Oko, and I stand on his behalf to read this address, this goodwill message. On behalf of the leadership and entire Christian community in Nigeria, I warmly extend the goodwill and solidarity of the Christian Association of Nigeria, CAN, to the Honorable Minister of Health, the Permanent Secretary, Directors, State Commissioners of Health, Development Partners, civil society actors, and all participants at this crucial sector-wide joint annual review meeting. This gathering represents an important moment in our collective efforts to evaluate progress, share lessons, and agree on priorities towards saving lives, reducing physical and financial risks, and strengthening the quality of healthcare for Nigerians. Your commitment to convening stakeholders from local governments up to the federal level reflects a commendable spirit of collaboration and accountability, values that are essential for national development. As you review policies, strategies, achievements, and persistent challenges within the health sector, CAN encourages you to remain steadfast in promoting an integrated, inclusive, and people-centered approach to healthcare delivery. Our nation continues to face health-related emergencies, disease burdens, infrastructural gaps, and economic pressures that threaten the well-being of millions. Yet, with the coordinated action and sincere dedication, we can overcome these hurdles and build a healthier future for our people. We commend the Ministry of Health for consistently providing a platform where diverse voices are heard and where progress is measured transparently. The openness of this process strengthens trust among citizens and ensures that the decisions made during this review translate into tangible outcomes in communities across Nigeria. The Church remains a long-standing partner in health service delivery through hospitals, maternity homes, mission clinics, humanitarian interventions, and community health awareness programs. We reaffirm our readiness to continue collaborating with government and development partners to support strong health systems, especially among vulnerable and undeserved populations. CAN prays for a successful conference and pledges its cooperation as we collectively work towards a healthier, safer, and more prosperous Nigeria. Thank you all. May the Lord bless you.
Thank you, sir. It's an inclusive arrangement at today's event because, as we all know, diseases don't have borders. And that has been the mantra of this health administrator in the country, bringing everyone on the table. At this point, I'd like to invite the Chairman, Health Sector Coalition, who is speaking for non-state actors and civil society, Dr. Mohammed Lekki. You have the floor. Dr. Mohammed Lekki, thank you. Please let's encourage him as we welcome him warmly to the microphone.
It's okay. Good morning, everyone. Please allow me to stand on existing protocols to save time. The Health Sector Reform Coalition is happy to join in welcoming all of us to this joint annual review of Nigeria's health sector. We extend warm greetings to the Honorable Coordinating Minister of Health, the Honorable Minister of State for Health, and other senior government officials, our partners that are present here, including those who are joining virtually. We express deep appreciation for the sustained collaboration and hard work that has brought us to this junction, building on the 2024 JAR exercise. We note with grave concerns that this year's review is coming at a time when the financial fortunes of the health sector leaves much to be desired, and at the same time, external health aids has dropped considerably by as much as 30 to 40% since 2023, causing immediate and severe disruption to critical health services such as immunization, maternal care, health emergency preparedness and response, and disease surveillance. We also continue to witness the Japa syndrome unabated. Almost every one of us here knows of a health worker, an SY colleague, or that town doctor who has jackpot overseas. We, however, recognize and commend some of the efforts that have been taken by the leadership of the Federal Ministry of Health in rising to these challenges, especially in very early on, increasing the health budget by as much as $200 million to offset sudden drop in external aid. But just that these solutions take time to materialize, and meanwhile, the pains and difficulties continue. We must find creative ways, working with the civil society organization, to get the Federal Ministry of Finance, thank you, Honorable Minister of Finance, welcome here, to get the Federal Ministry of Finance to release funds to the health sector as appropriated. We must not be celebrating increases in budget on papers alone, but releases and utilization. We at the CSOs are concerned that steady progress being made with the transparent fund flow within the Basic Healthcare Provision Fund arrangement. We're happy to see this progress. It demonstrates what is possible when funds are made available. The Basic Healthcare Provision Fund has become the anchor for ongoing reforms across all levels of government, but this is not enough. The health sector needs significantly more money. As a civil society organization, we remain committed to the principle that guides our work, accountability and transparency in how resources are used, meaningful participation of communities in decision-making, and measurable improvement in health outcomes for all Nigerians, especially women, children, and the poor. We are here to join in the review progress since our last meeting to identify gaps, celebrate achievements, and agree on concrete actions for the year ahead. Our shared mission remains clear: the inalienable rights of all Nigerians to health in all our communities, in reducing preventable illnesses, deaths, as well as increasing life expectancy. Essentially, a mutual commitment on our part with the government, the Federal Ministry of Health, to deliver on the reforms as contained in the health sector basic strategic blueprint. As CSO, we look forward to suitable access to essential health services, regardless of geography and income, stronger health system, that are resilient in the face of shocks, including emergency, epidemic outbreak, and climate-related risks. Persistent gaps and challenges remain, such as the socialization of the SWAP program. As desirable as it is, still got a long way to go. We must acknowledge and address persistent fragmentation of service delivery across levels of government and between public and private sector. We would also like to note issues with equity, significant disparities in access to care for urban communities and rural areas, and disability among marginalized groups. This ramping up of PhD facilities and services are progressing, but much more is needed with adequate financing. Human resources for health is fraught with shortages, uneven distribution, and the need for ongoing training and retention shortages, especially to stem the Japa syndrome. Out-of-pocket costs are still far too high, and too many households, and the need for diversity protect funding to essential services. Health is still not a very high political and funding priority, even as we note the commitment, the efforts, and the leadership of the Federal Ministry of Health. We all, especially CSO, have taken the decision to work with the Federal Ministry of Health, to advocate to the Federal Ministry of Finance, to put more money in health and release this money to them to do the work that needs to be done. Let me end by noting that we look forward to substantial engagement and support to CSOs to play a complementary role to deliver on the reforms under the leadership of the Federal Ministry of Health, and to observe that starting from this very jar, we have prepared a report on the CSO's assessment of what is happening in the health, and this will be submitted in the course of this discussion. The sector reform wishes all of us productive joint review for 2025. Thank you very much.
Thank you very much. The CSO's voices there by Dr. Lekki. More money, prompt release that will make way for equity healthcare delivery in the country. Again, let's appreciate that voice from the Nigerians, I would say. Our next goodwill speaker is Dr. Njide Ndeli, Health Federation of Nigeria president, leading that pack and doing so well. Well, there's a man here representing Dr. Ndeli. All right. I'll yield the microphone. You're welcome.
Thank you. Good morning, distinguished ladies and gentlemen, honorable ministers, state executives present. I stand on all existing protocol, traditional rulers. My name is Dr. Benson Ayodele Cole. I'm the first Vice President of the Healthcare Federation of Nigeria. I'm representing our President, Njide Ndeli, to deliver this goodwill message. On behalf of the Healthcare Federation of Nigeria, I am deeply honored to deliver this goodwill message at this joint annual review of the sector-wide approach, SWAP. This gathering is a testament to our shared commitment to strengthening Nigeria's health system through collaboration, accountability, and evidence-based decision-making. The SWAP platform provides a unique opportunity for government, development partners, the private sector, civil society, and professional bodies to sit around the same table to review our progress and agree on practical steps to move forward together. I would like to especially thank the Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, for the strong recognition of the Healthcare Federation of Nigeria and for deliberately and consistently engaging the private sector as a core partner in the implementation of the national health priorities. This intentional collaboration has sent a clear signal that the private sector is not an afterthought, but an integral part of the solution to Nigeria's health challenges. As President of the Healthcare Federation of Nigeria, I also wish to commend the Federal Ministry of Health and Social Welfare, the state ministries of health, and all partners who have continued to champion this coordinated approach. The discipline of reviewing what has worked, what has not, and why is essential if we are to achieve universal health coverage and improve the health outcomes of every Nigerian. At Healthcare Federation of Nigeria, we have made significant strides in aligning with government across all pillars. We have signed a compact on the power for health on behalf of the private sector, reinforcing our commitment to ensuring reliable power as a foundation for quality healthcare delivery. We are partnering with the Presidential Initiative for Unlocking the Healthcare Value Chain, PVAC, to advance local manufacturing and better align health investments with national priorities. We are supporting the National Health Insurance Authority to define strategies for increased enrollment from the private sector and to determine how best to improve quality of care through the private sector providers network. Healthcare Federation of Nigeria was included in the committee that worked on the possibility of establishing a National Healthcare Facility Regulatory Authority, NEFRA, which is now progressing through the legislative framework to ensure that sustainable and credible regulation of our health services across the nation actually takes place. We are further supporting public-private partnerships at the primary healthcare level and looking forward to strengthening collaboration with the Association of Local Governments of Nigeria to advance linkages with government and the communities that we serve. Healthcare Federation of Nigeria is in discussion with the National Institute for Cancer Research and Treatment, NICRAT, for the inclusion of private healthcare facilities in the diagnosis and treatment of cancers within the ongoing implementation of the Catastrophic Healthcare Fund. Through these efforts, we aim to ensure that the agenda of the private sector are fully harnessed in supporting our national health goals. We are therefore extremely honored that the Healthcare Federation of Nigeria has been included as signatories to the updated compact on universal healthcare coverage, a privilege we take very seriously as we commit to doing our part to ensure that no one is left behind. The private health sector, which HFN represents, remains a critical pillar of service delivery in Nigeria across primary, secondary, and tertiary care, as well as in diagnostics, pharmaceutical, health insurance, technology, and supply chain management. Private sector operators are often the first point of care for Nigerians across the demographics. It is therefore encouraging to see the increasing recognition of private sector as a true partner in planning, implementation, and monitoring within the SWAP framework. In this review, we hope to see stronger data use and transparency so that decisions, especially on resource allocation, are driven by accurate, timely, and shared information across private and public sector actors. Clearer rules. Number two, clearer rules and responsibilities defining how government, private providers, and partners can complement each other in areas such as primary health care, emergency care, maternal and child health care, non-communicable disease management, and digital health. Number three, sustainable and innovative financing mechanisms, including better purchasing arrangements, strategic use of insurance, and performance-based models that reward quality, efficiency, and impact across both public and private sectors. Number four, regulation that enables rather than stifles growth, ensuring that standards, accreditation, and quality assurance processes are practical, consistent, and encouraging and encourages responsible expansion of the health sector. As I conclude, HFN remains committed to providing credible voice to the organized private sector in policy dialogue and technical working groups. We are available to offer trusted a platform to align and attract investment into health systems through private sector engagement. We are also supporting capacity strengthening, particularly for quality improvement, governance, and digital transformation of private providers. Partnering also with government at the federal, state levels to pilot and scale innovative models of care that can be integrated into the SWAP framework and national strategies. On our part, the Healthcare Federation of Nigeria stands ready to work with all stakeholders represented here today to translate these commitments into reality. Together, we can build a more resilient, equitable, and inclusive health system for Nigeria. I congratulate the organizers for convening this important review, and I wish us all fruitful deliberation. Thank you, and God bless you. And this is from Njide Ndele, President of the Healthcare Federation of Nigeria, who is currently engaged at the Quality Conference holding in Lagos at the moment. Thank you very much. Thank you.
Thank you very much. As we move on, all hands, one mission in partnership for health sector delivery service in Nigeria. I'd like to welcome Dr. Mary Nana Ama Brantau, representative of the Health Development Partners Group, who will address us next. Please welcome my sister most heartily.
Thank you very much, Auntie Moji. And I would read this goodwill message on behalf of the Development Partners Group. Professor Mohammed Ali Pate, Honorable Coordinating Minister of Health and Social Welfare, Dr. Olawale Edun, the Minister of Finance and Coordinating Minister of the Economy, Senator Abubakar Atiku Bagudu, the Honorable Minister of Budget and National Planning, Dr. Isiaq Adenkule Salako, Honorable Minister of State for Health and Social Welfare, the Special Advisor on Health to the President, Dr. Salma, Honorable Commissioners of Health from the states, Ms. Daju Kacholum, MNI, Permanent Secretary of the Federal Ministry of Health and Social Welfare, our spiritual fathers, our traditional rulers, heads of development agencies, civil society representatives, members of the press, distinguished ladies and gentlemen, please permit me to stand on the protocol that has already been observed. In case I miss anyone out, I have acknowledged you. On behalf of the Health Development Partners Group in Nigeria, and let me say also on behalf of the ladies here, because I'm the first lady to come here. So on our behalf, thank you very much. Thank you very much. On our behalf, I extend our warm congratulations to the Federal Ministry of Health and Social Welfare for the remarkable progress achieved in advancing Nigeria's health sector reform agenda. The strides made under the Health Sector Renewal Compact and the collaborative spirit reflected in this joint annual review exemplify the principles of the Lusaka Agenda, which is country leadership, inclusive partnerships, mutual accountability, and alignment for results. As partners, we would particularly like to commend the leadership for the updated compact and its addendum, which broadens stakeholders' engagement and reinforces the shared responsibility for achieving universal health coverage. The portfolio review session, a critical step towards aligning resources for results and strengthening accountability frameworks. Thirdly, the emphasis on evidence-based dialogue and inclusive participation, ensuring that citizens' voices and state-level performance inform national priority. And also, fourthly, the launch of key strategic documents, including the Climate and Health National Adaptation Plan and the second National Action Plan on Health Security. The Joint Annual Review provides a valuable opportunity for us to assess the achievements of the previous year and to reflect on the impact of policy decisions. And this is in line with the provisions of the compact that was signed in December 2023. And it also underscores our commitment to work jointly and collaboratively with all the relevant actors in place. As partners, we reaffirm our commitments to coordinate and align our support behind national government priorities, to mobilize resources for impactful interventions, and strengthen systems for data-driven decision-making. We also pledge to commit towards the support of subnational engagement, ensuring that every investment contributes to measurable improvements in health outcomes. Finally, let me once again congratulate the leadership of the Federal Ministry of Health and all the directors and all of those who have made this work to convene this important platform for reflection, for learning, and collective action. Together, we can deliver on the vision of a healthier Nigeria. I thank you.
Thank you very much. Together, we're moving steadily and we would get there. I'd like now to invite the Country Director of the World Bank, Mr. Matthew Verghese, to also give his goodwill message. We need to give a very loud round of applause. This is World Bank, eh?
Honorable Ministers, Excellencies, ladies and gentlemen, with such a distinguished audience and only 2 minutes, it's very convenient to stand on existing protocols. Our coming together today for this annual review of the SWOP is a demonstration that the commitment to universal health coverage by all relevant partners and actors is not just on paper, but a living commitment. The World Bank is very much aligned with this goal and with the Universal Health Coverage Compact. In fact, progress towards universal health coverage globally, not just in Nigeria, is one of the key indicators by which we will be measuring ourselves going forward. We have set a global target of 1.5 billion people to be reached by health services in 2030. And ever since I took this job, my management has been reminding me that unless we achieve these goals in Nigeria, we're not going to achieve them globally. Despite these commitments and the very real progress on important measures such as maternal mortality, Nigeria still ranks low on the Human Capital Index, which is a broad measure of outcomes in health, in education, more broadly. Accordingly, within the SWOP, we suggest 3 priority areas of focus going forward. One, and I'll speak a little bit about each of them. The first is improving the implementation of the SWOP through a strong accountability framework, which in fact is the focus of the updated compact. A focus on early childhood and a prioritization of development spending. On improving the accountability framework, the World Bank is supporting accountability through a new set of linked operations focusing on health, education, and governance, the HOPE operations. Key measures include revisions to the basic health, the basic package guidelines, strengthening the link between funding and outcomes, and mandated annual audits. The HOPE operations also support states to consolidate funding sources towards multi-year planning, enhance budget execution and transparency, publishing of local government budgets, conducting financial and performance audits of primary health care, and closing the resource gap for critical healthcare workers. All of these, we think, will be strong steps towards the implementation of the SWAP. Second, a focus on early childhood. An analysis of Nigeria's Human Capital Index suggests that the largest returns and opportunity for improvement will come from investing in early childhood starting from pregnancy. Focusing on stunting, maternal mortality and child mortality and early learning can have tremendous benefits. Countries that have achieved success on this have taken a multi-sectoral approach, including health services aimed at mothers and children, nutrition, water and sanitation services, and foundational learning. And finally, a prioritization of development spending, something that has been mentioned by almost all the speakers that have come before me. Thanks to the ongoing macroeconomic and fiscal reforms, Nigeria has a real opportunity to spend better and to improve human capital. This will come from prioritizing these areas of expenditure, but it's also worth noticing that subnational governments are receiving substantially higher revenues, while priority social sectors, such as including health, have not experienced commensurate increases in funding. A focus on these sectors will be even more important as development assistance is likely to fall. A focus on universal health coverage will be key to achieving the objectives that we have set out today, and we at the World Bank are committed to joining all of you in achieving the results that you have laid out. Thank you very much.
I think he deserves another round of applause. With continued commitment, as spelled out by him, we would get to the promised land. Well, within the context of global best practices, we also have the World Health Organization in-house, who is also lending their voice to this Joint Annual Review 2025. Please welcome with me Dr. Pavel Ursu, WHO Country Representative in Nigeria. Please, let's give him a very, very, very warm welcome. He's new. Good to see you.
Very good morning, honorable coordinating ministers, all protocol observed, traditional leaders, members of the civil society, members of the press. I'm honored to extend my goodwill message today, this morning, and congratulate the Federal Minister of Health and Social Welfare and all stakeholders for the Joint Annual Review 2025. This summit comes in a crucial timing in the history of the health sector in Nigeria, when a strong country leadership is driving the unprecedented health transformation to make progress on delivering essential health services with financial protection to its citizens and achieving or moving in the journey towards universal health coverage. For me personally, as the Master of Ceremonies mentioned, is also a very important meeting because this is my first joint annual review, because I joined the UN country team here very recently, and I'd like really to first of all, thank very much the federal government of Nigeria, the presidency, for the warm welcome. I really wish to congratulate the presidency for the Vision and Renew Hope agenda, which now is translated into the Health Sector Renewal Investment Initiative of the Federal Ministry of Health and Social Welfare, ably led by Professor Mohamed Ali Pateh. The Joint Annual Review is not just a meeting, it's a cornerstone of accountability, learning, and collective action. And as outlined in the WHO Global Guidelines on the health sector performance reviews, joint annual reviews are essential mechanisms for countries to assess progress towards agreed national targets, identify bottlenecks, and align resources with priorities in accelerating measurable and tangible results. So the reviews embody the principle of transparency, evidence-based decision-making, and inclusive dialogue. I was also very impressed to see the release of the health sector statistical book linked to joint annual review, and I'd like really to congratulate the ministry for that. Nigeria's commitment to the one report, one conversation principle and the integration of the joint annual review within the sector-wide approach and the Sector Renew Investment Initiative framework is commendable, is a really impressive practice. It reflects a maturing health system that values results, equity, and accountability. As WHO and partners, we are really proud to have supported the technical, strategic, and operational dimensions of this process, from indicator validation and data analysis to strategic alignment within the UHC goals. We remain committed to working alongside the ministry partners to ensure that evidence generated here translates into impactful policies and improved health outcomes. As we reflect on the progress made and the challenges ahead, particularly in maternal and child health, immunization, health system financing, let us reaffirm our shared accountability and responsibility. Let us also remember that we are stronger when we act together. In this spirit, I'd like to reiterate our commitment and the commitment of WHO and working as one UN at the country level, at the leadership of the UN Resident Coordinator, that we will work in synergy to support Nigeria's health sector transformation and ensure that no one is left behind. Thank you, and I wish you all a productive and inspiring review. All hands, one mission.
Indeed, all hands, one mission. As I call in our next speaker, Chief Country Delivery Officer for Gavi, Thabani Mamposa. Okay, that applause was very loud, so let it continue.
Honorable Coordinating Ministers, Your Royal Highnesses, please allow me to stand on established protocols. Last time when I stood here, I gave you a sense of the rain that was impeding. And I said to you, imagine that rain beginning to make some sound from a distance, but imagine that rain beginning to smell on your nose as it is coming from the ground. And that was the change that we were seeing, that was on the way, that the Honorable Minister Mohamed Pate was ushering. This was about the swap. This was about the energy that was in the room, that something good was about to happen. I'm glad to be coming back this year. The first thing that I want to celebrate is that we're in a much bigger room. And so it shows that the annual review is getting better every year. But there are some celebrations that I really want to bring forth. The first one is to thank you, Minister Pate, for supporting Gavi on its replenishment. A replenished Gavi is a Gavi that is ready to support Nigeria. And thank you for being in Brussels. Dr. Sanya Nishta said I must pass these regards and this gratitude. Secondly, I happened to be traveling recently, and I was in a country that was launching HPV. And I couldn't help but celebrate the success of Nigeria. They say that success has many mothers and also fathers. So when I got to Pakistan, and the Minister of Pakistan said to me, who can we learn from in terms of really doing HPV very well? I said Nigeria. Sometimes we share that success, and there is not much that some of us would have done sitting in Geneva, but we share your pride and the contribution that you make in terms of best practice and achievements. I want to come again and celebrate the good news that I have heard on the measles rubella that is undergoing right now. I've heard that Nigeria is leading the pack. You have a bold goal of reaching 100 million children, and I'm hearing that you are on your way there, and you are doing it with style. So I want to celebrate that because of the way it has been done. You are doing it with polio at the same time, an integrated campaign. I think one of the things that I've seen since Minister Pate took office is that his word and his action, there is not a big gap between the two. Quite often I travel to London, and when I get out of the train, it says mind the gap. And minding the gap means that we must always make sure that our rhetoric and our reality does not have a distance. And Minister Pate, congratulations for minding the gap. As Gavi, I want to say that we said we are committed to partner with Nigeria. That commitment is steadfast. It is unchanged. It remains strong. And Nigeria's success is Gavi's success. So as part of our goodwill messages, we wish you the best, and we commit that we will be right behind you on every part that you want us to be in. Dr. Sanya Nishta has launched an initiative that says the Gavi Leap, which means that country priorities are our priorities, and that is our commitment. Last but not least, of course, I will not leave this podium without a challenge. There are things that we can still do strongly together, and we are here to discuss and to see how we can tackle the conversation of financing. I actually say today is a success. Having the two coordinating ministers and the Minister of Budget here is such a pleasure. Ministers, we are here to serve. We are here to support you. Thank you.
Thank you very, very much. And I think we should appreciate him one more time, coming out so strongly to give service. Perhaps what we are doing here this morning is representing the 200 million plus Nigerians out there who do not have the opportunity of being in this room with us, but whom we must carry along. And we have representing that constituency or that cluster of Nigerians that needs to get health and get it right. It is on this behalf that I want you please to put your hands together as I invite the Honorable Chairman of ALGON, Engineer Bello Lawal, who is speaking on behalf of all the local government chairmen in this new dispensation. Let's welcome the representative of ALGON.
The Honorable Minister, Coordinating Minister for Health, distinguished invited guests, ladies and gentlemen, permit me to stand on the protocols already established. Distinguished invited guests, ladies and gentlemen, I stand here on behalf of the National President of ALGON, but President with a small p, to make a goodwill message on behalf of the 774 local governments of Nigeria. It gives me a great pleasure to join distinguished stakeholders, partners, and development actors in this important gathering. On behalf of the Association of Local Governments of Nigeria, I commend the Federal Ministry of Health and Social Welfare under the able leadership of the Coordinating Minister, Dr. Patti, for their continued collaboration and commitment to strengthening Nigeria's health system in line with our national developmental priorities and sustainable development goals. We thank the Coordinating Minister for Health and Social Welfare for the recognition of ALGON in the Basic Healthcare Provision Fund 2.0 and pledge ALGON commitment to deliver on its mandate and full support for the SWAB coordination of the Nigerian health system. Distinguished invited guests, ladies and gentlemen, this annual review offers a unique opportunity to reflect on the progress made, the challenges encountered, and the strategies required to further consolidate gains in our collective pursuit of universal health coverage. It is a demonstration of accountability and shared responsibility, principles that are fundamental to effective health governance. As a tier of government, ALGON, on behalf of all the 774 local government, therefore reaffirms its full commitment to strengthen expected new primary care under one roof policy, enhancing community participation and promoting efficient resource utilization at the grassroots level. We recognize invaluable support of our partners, including but not limited to WHO, UNICEF, Gavi, and for their sustained contribution to health system improvement in Nigeria. Going forward, ALGON will continue to champion local ownership, accountability, and innovation to make this investment a sustainable one. As we align, review, and renew our commitments under this meeting, I urge all stakeholders to maintain a people-centered approach that prioritizes equity, inclusiveness, and resilience within the health sector. Together, we can build a healthier, more productive Nigeria. Once again, I thank the organizers of this important review session and wish all participants fruitful deliberations. Thank you, and God bless the Federal Republic of Nigeria. Thank you very much. Thank you.
Thank you, Algon. We cannot get it right unless, of course, the states get it right. And in recognizing the important role the states play in ensuring equity at that level, I'd like to invite Dr. Mohammed Lawal Ghana, who will speak on behalf of the health commissioners, on behalf also of the chair of that committee, Dr. Yubanji Felani, who is not here. Dr. Ghana, you have the floor.
The Honorable Coordinating Minister of Health and Social Welfare, the Honorable Minister of Finance and Coordinating Minister of the Economy, the Honorable Minister of Budget and Planning, our own Honorable Minister of State for Health. Honorable Ministers, please, with your kind permission, in the interest of time, I would like to recognize each and every one that is in the hall. I would like to begin by expressing the apologies of the chairman of the Honorable Commissioners Forum, who unfortunately had some mix-ups with his flights. So he requested that I represent him. Good morning, everyone. It is indeed a great honor for me to bring warm greetings and goodwill from the Forum of Honorable Commissioners for Health across the 36 states and the FCT to this important 2025 Joint Annual Review Meeting. The Joint Annual Review Meeting continues to be a very important platform for us all, a space where we take stock, share experiences, celebrate our collective achievements, and reflect honestly on areas that still need attention. It is through forums like this that we continue to strengthen our shared vision for a healthier Nigeria. As Commissioners for Health, we deeply appreciate the continued leadership and coordination of the Federal Ministry of Health and Social Welfare, the strong partnership of our development partners, and the dedication of all stakeholders working tirelessly at both national and subnational levels. Across the states, we are making steady progress, strengthening primary health care, expanding health insurance coverage, improving our response to maternal and child health care, and advancing the One Health agenda. We are also encouraged by the implementation of the sector-wide approach, which provides a common framework for planning, coordination, financing, and performance monitoring. The SWAP is helping to bring greater coherence to our health investments, ensuring that federal and state priorities are aligned and that resources are used more efficiently to achieve results that truly matter to our people. The Forum of Commissioners reaffirms our commitment to the success of this approach. We believe that when all partners, federal, state, and development, move together under one coordinated framework, we can accelerate progress towards universal health coverage and health-related sustainable development goals. We therefore see this joint annual review not just as an annual event, but as a renewed opportunity to learn from one another, to stability, and to build on the momentum of reforms that are already shaping the future of Nigeria's health sector. On behalf of the Forum of Honorable Commissioners for Health, I wish the Honorable Coordinating Minister, all our partners and participants, fruitful deliberations and successful outcomes. Thank you, and God bless the Federal Republic of Nigeria.
Thank you, Dr. Ghana, and members of your team for the great job at that level of governance. We're moving on, and at this point with a whole lot of pride, and I think my sister Mary felt a bit lonely when she did say that we haven't heard the voices of women. So proudly and loudly would like to announce that our next speaker is a woman, one that we are very proud of. All the women in the hall, can we please put our hands together? And of course, the men as well, as I invite the Senior Special Advisor to the President on Health, Dr. Salma Ibrahim Anas, to address the House.
Thank you, my sister, Chief Moji. The Honorable Coordinating Minister of Health, Professor Ali Mohammed Pate, the Coordinating Minister of the Economy and Honorable Minister of Finance, you're welcome, sir. The Honorable Minister of Budget and Planning, Alaja Atiku Bagudu, Your Excellency, you are most welcome. The Minister of State for Health, the Permanent Secretary, our members that are here, Chair and Vice Chair, Honorable Adebayo and Honorable Amos, we are happy to have you here with us today. The Honorable Commissioners of Health from all the respective states, my sister, Senior Special Assistant, Public Health in the Office of the Vice President, our Royal Fathers, you are most welcome. Our own President, President of NMA, Nigerian Medical Association, I acknowledge you. The Executive Secretaries, Directors, private sectors that are all here. A very good morning to you all. It is my distinguished honor to be at this joint annual review 2025, the very essence of accountability in the health sector development. His Excellency President Bola Ahmed Tinubu's renewed hope agenda places the well-being of every Nigerian at its core, with an unwavering commitment to saving lives and reducing financial hardship, but also, most importantly, delivering quality health care for all. The JAI is our accountability platform, where we thoroughly evaluate performance, recognizes successes, and with all honesty and sense of responsibility, address areas for improvement. Building on previous JAS, dating back to 2010, this review is now led by a new health sector renewal investment initiative and the health sector blueprint, incorporating new innovations that strengthen our accountability. I commend the efforts of the Coordinating Minister of Health for re-energizing the system and bringing in new additional innovations to make it better. This year's theme, All Hands, One Mission, bringing Nigeria's health sector to light, reflects three principles: accountability for resources, learning by sharing lessons, and action through collective participation. As we review the past year, we must focus on the core imperatives to build a resilient system. In her welcome address, the Permanent Secretary did mention where we stand. We still have much to do in terms of meeting our commitments, the Sustainable Development Goal, SDG 3. There are still gaps, and we must tell ourselves so that we re-energize ourselves and repositions ourselves to do more better. But I can say it is feasible and realistic with the high-level commitments that we have from the leadership of the Federal Ministry of Health and the commissioners that we have at the subnational level. However, permit me to reiterate a few critical areas. First, we must move away from external reliance. and expand our domestic funding, ensuring resource flow reliably to the front line, primarily through the basic healthcare funding. Second, we must mobilize funds. It's not just about the funds alone. We must ensure that every naira mobilized is used optimally through rigorous efficiency and unwavering accountability. As I always say, health is about life. You either give it to health or you don't see health. There are only two ways out of it. It's not like road construction where you can change your way and take another route to travel to where you are. Transparency is our watchword and must be fully institutionalized with open and transparent trackers. Furthermore, we must build a coordinated, resilient health systems across all levels, strengthening subnational levels, including the local government. Involvement is vital. But we must also ensure functional linkages between our primary, secondary, and tertiary facilities. I must mention that His Excellency President Bola Ahmed Tinubu's administration has placed health as central to development, and it's not just a mere standalone health entity that requires a holistic, whole society approach to deliver. We must therefore mandate cross-sectional collaboration, all sectors of development, for example, agric, the environment, climate, women, youth, including the security agents, among so many, just to mention, as the magnitude of our challenges requires an all-hands approach. The joint annual review is our moment to renew social compact, as has been said earlier. Let this week be redefined by constructive commitment, a commitment to finance our future, to spend wisely, and to build a unified system for universal health coverage. It just reminds me when I look back, when we started this journey about 2.5 years, under the leadership of Mr. Wale Edu and also Dr. His Excellency Atiku Bagudu, who chaired and co-chaired the Presidential Advisory Committee. We developed visions, priorities for Nigeria, pillars for Nigeria. We thought we should achieve what within the measurable indicators, within the first 100 days, within the first 2 years, and within the last 4 years. However, we didn't envisage, though we made assumptions that things can change, things can shift, but we didn't envisage a massive shift in the economy. We didn't realize that there will be dwindling, or what I say, attrition, withdrawal of huge donor resources from the ecosystem. And also, we didn't realize there will be escalation of the security challenges across the country, as well as escalation also of socio-cultural barriers. But here we are today, 2.5 years, to God Almighty be the glory. We have made progress, despite all the challenges. And I must acknowledge the pragmatic leadership of the Coordinating Minister of Health, this team, the Minister of State for Health at the national level, but also the commitment and the demonstration of efforts to work in a very fragile, very difficult environment by the Commissioners of Health and their team at the subnational level. We've been able to make progress. We've been able to make progress. I think we achieved almost more than 100% of the 100 days in office. We should appreciate ourselves. Well, this is 2.5 years, and I can comfortably say it also that if you look at the 8 pillars of President Bola Ahmed Tinubu around the health sector, we've achieved almost all of them. Very few are still work in progress, and I believe that we can achieve within the next few months. I would say a very big thank you, Honorable Minister, Coordinating Minister, and your team, and all the commissioners of health that are here, all our stakeholders, including the private sectors, that have assiduously also worked under the new innovation, the new initiative, the PVAC, Dr. Mukhtar. We've seen the great efforts that you are doing. It is indeed remarkable. If I would assess the health sector, I said that would be my number one in terms of doing things differently in Nigeria. And that is the future we want to see for the new Nigeria, the new future of Nigeria. Thank you so much, and I wish to highly appreciate the JAR 2025, and may our collective mission of bringing the Nigerian health sector to life be a success. May Almighty Allah help us all. Thank you.
Thank you again, Dr. Salma Ibrahim Anas, Senior Special Advisor to the President on Health, speaking on reflection and, of course, giving us some of the challenges and, of course, successes that have been achieved since the administration came into being. We move on now, and we'll be listening to our guests from the legislation. Very important. The National Assembly, they do all the legislative network. That is important. And in the last 48 hours, they have been meeting to ensure that laws are made that will accelerate healthcare delivery service. And so representing that wonderful and important arm of governance is the Honorable Dr. Adeshola Adedayo, who is representing Senator Banigo Harry, Chairman, Senate Committee on Health, and he will be speaking on behalf of the National Assembly. You're welcome, sir. You have the floor. By the way, he's a medical doctor himself, and I remember him as an activist in those days. We'll listen to him and see if he's still firing.
Thank you, Chief Mrs. Mojima Kajuola, MFR. My name is Dr. Adeshola Adedayo. I represent the good people of Apapa Federal Constituency. I am from the state of aquatic splendor and the center of excellence. We are from Lagos. I'm standing in for Senator Dr. Banigo, who is unavoidably absent. She is the Senate Chairman for the Committee on Health, both secondary and tertiary. The message will be ours, but the voice will be the voice of Dr. Adedayo. The Honorable Coordinating Minister of Health and Social Welfare, the Honorable Minister of Finance and the Coordinating Minister of the Economy, Chief Wale Edun, my leader from Lagos. If you want to clap, you can clap for him. The Honorable Minister of the Budget and Planning, His Excellency Senator Bagudu, the Honorable Minister of State for Health, Dr. Salako, the Permanent Secretary, the Ministry of Health, and other Permanent Secretaries that are here, distinguished colleagues from the National Assembly, Honorable Commissioners of Health that are here, the heads of departments and agencies in the Ministry of Health, development partners, traditional rulers, civil society representatives, the media, and friends of the health sector. Good morning. It is truly an honor to join you once again for this year's joint annual review, a platform that stands at the very heart of Nigeria's growing health sector reform journey. Over the past year, Nigeria has taken significant steps towards transforming its health sector, guided by the renewed hope health agenda of His Excellency President Bola Ahmed Tinubu, GCFR. Through this agenda, Mr. President has provided a clear and compelling vision to build a bold, resilient, and people-centered health system that delivers better health for every Nigerian. As the saying goes, our healthy population is the foundation of a prosperous nation. Under the leadership of our dear and able coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, this vision has been translated into an actionable national framework. The Nigerian Health Sector Renewal Investment Initiative, NHSRII for short, which is not just another reform plan, but is a transformational agenda, reshaping our health care delivery across the nation by improving funding, governance efficiency, and service quality for all Nigerians. On the part of the legislature, we have just concluded the 6th Annual Legislative Summit on Health, themed Building Responsive, Sustainable Health System, leveraging legislative action for digital innovation, human capital, and infrastructure for universal health coverage. This event had the gathering of the speakers of the 36 states' houses of assembly, the clerks of the state house of assemblies, the chairmen of the health and appropriation committees, as well as the health commissioners, health committees, clerks, and secretariats. It reinforced one message above all others, that the legislature is not only a lawmaking institution, but a catalyst for innovation, sustainability, and transformation in Nigeria's healthcare sector. We examined the following pivotal themes: digital health for a future-ready health system, strengthening human capital through innovation and data intelligence, innovating for impact towards universal health coverage, legislative pathways to a more efficient, sustainable domestic health financing, powering health system for resilience, ensuring reliable energy and climate-resilient infrastructure for universal health coverage. Each pointing to where legislative action must be focused in the years ahead, ensuring that the Nigerian health workforce remains equipped, motivated, and digitally ready to deliver quality care at all levels in our appropriations. We call for innovative financing mechanisms, including results-based financing, ensuring that every naira spent delivers value for health by institutionalizing smarter financing approaches, expanding fiscal space for health, and sustaining partnership across board. We examined the role of reliable energy and climate-resilient infrastructure in strengthening service delivery. Too many of our health facilities still operate without stable electricity or clean water. These dire conditions strengthen our vaccine storage, emergency care, and the functionality of digital systems, among many other interlinked services. As chair of the Legislative Network for Universal Health Coverage, LNU, my position continues to reaffirm that the legislator remains not just a participant, but a policy driver in Nigeria's health sector reform journey. As chairman of the Senate Committee on Health, Secondary and Tertiary, I take pride in the fact that our legislative health agenda, themed Improving Stewardship for Universal Health Coverage, continues to serve as the roadmap of the Joint Health Committees of the 10th National Assembly, guiding our collective intervention of health. Beyond advocacy, we have chosen to demonstrate commitment through action on the pillars of resource mobilization and in keeping with our collective legislative commitment to sustainable health financing. I have taken the initiative among several other bills, to sponsor the bill to amend the National Health Act of 2014, which seeks to increase the Basic Health Care Provision Fund, BHCPF, from 1% to 2% of the Consolidated Revenue Fund. It was read for the first time in the hallowed chamber on the 9th of July 2025. I am pleased to share with you that on the 22nd of October 2025, my distinguished colleagues unanimously, with one voice, supported this historic amendment for the second reading, paving the way for a robust public hearing as we galvanize the much-needed national support for this cause. With rising service demand, declining donor assistance, and out-of-pocket expenditure now exceeding 75% of total health spending, the current 1% allocation has simply become inadequate. We ensured appropriation for the Vulnerable Group Fund in the 2024 and 2025 budgets, which is geared to improving health insurance coverage for the vulnerable groups through the National Health Insurance Agency pathway. We are committed to ensuring other means of innovative financing, including a percentage of customs and excise on sugar-sweetened beverage tax and other health taxes. The amendment of the National Health Act 2014, when enacted, will 1, double the resources available to revitalize our primary health centers. 2, strengthen the health workforce and guarantee steady supply of essential medicines. 3, safeguard immunization and maternal health programs as donors' support declines. And 4, most importantly, ensure that more Nigerians, especially women, children, and those in rural communities, can access quality care without financial hardship. I use the Joint Annual Review 2025 to call for your collective support of the Nigerian Governors Forum and all other stakeholders for this amendment. Our President, His Excellency President Bola Ahmed Tinubu, GCFR, has demonstrated unprecedented commitment and affection for the health sector under the renewed Hope Health Agenda. We reaffirm our readiness in the legislature to complement this vision, because when health financing is secured, every other reform, from governance to service delivery, can now stand on a firmer foundation. As I conclude, let our Joint Annual Review 2025 not only review the past, but also affirm our collective resolve for the future. If 2024 gave us the tools, 2025 must deliver the results. Let us remember, data does not save lives. Decisions based on data do. Policies do not heal. Implementation does. And reports do not transform system. Commitment does. I thank you all.
Thank you very much. I think the National Assembly, as presented in this address, deserves a very loud round of applause as we look forward to all the promises that have been made. Just like to recall some of the things that they want us to remember. Data does not save lives. Decisions based on data speaks. Policies do not heal. Implementation does. And reports do not transform systems. Commitment does. Another round of applause. As we look forward to the realization of the good news from the National Assembly, on behalf of all of us, Your Excellencies, all very distinguished ladies and gentlemen, I'd like to now invite the Honorable Minister of State for Health and Social Welfare, Dr. Ishaq Salako, to please give his remarks. Let's welcome him warmly.
Thank you very much, our ageless Auntie Moji. the Coordinating Minister of Health and Social Welfare, my brother, Professor Mohammed Ali Pate, the Minister of Finance and Coordinating Minister for Economy, Mr. Wale Edun. When you were introduced earlier as a leader from Lagos State, most people did not clap because you're actually our leader from Ogun State. So, and you can see that